Well, we're on week 15 of COVID discussions. I think we've had about 13 Facebook Lives. We missed 2 going to every other week, but we're on week 15 now, which is really hard to believe. I'm Dr. Jim Heise, Chief Medical Officer at Door County Medical Center, joined once again, as always, by Sue Powers, Health Officer and Public Health Manager, which I think I finally got right. So that's
Excellent.
Good. It only took 15 weeks. You know, I can be taught. You know, sometimes it's dicey, but it can happen. So anyway, thank you so much for joining us. We're going to be very happy to answer any questions you might have. We'll try and go over some updates, and we'll see where this takes us. We'll try and keep it to about a half an hour, but that'll be flexible depending on the kind of response we get. So I'm going to go ahead and turn it over to my esteemed colleague for a general update.
Sure. As usual, I'll give the numbers. We're still at 39 positive confirmed COVID cases in Door County residents, and we've been at 39 for almost 2 weeks, so that's really good. Of those 39, 34 have recovered. We've had the 3 deaths. We've had 2,300 negative test results, and as of this afternoon, there's 109 tests pending because Door County Medical Center keeps testing, which is great. And just to follow up on the community testing that was 2 weeks ago with the National Guard here, it was a great event. We tested 400 people altogether, and from that there were 3 positives. None of those folks happened to reside in Door County, so our number didn't change from that. The 3 positives were from our neighboring counties, Brown or Kewaunee County. And that's about all I have right now.
All right. Well, just to point out that we do have, we've come up with a kind of a nice list of questions that have been asked fairly steadily over the course of the weeks, and there is a frequently asked questions page on the COVID update area of dcmedical.org. So feel free to go on there and take a look at that. There's lots of questions that you can read more about. So that'll be a great resource for you.
There's also frequently asked questions on the Door County COVID website, and I read theirs today, and they're really great answers. Our questions are a little bit different, more about travel and county policies and that kind of thing.
Yeah. And also we have, there, if you're interested, there is a YouTube video on masking that's also, I believe, up on the in that COVID area. If not, you can go onto DCMC Door County Medical Center's YouTube page. We're going to be putting up there another one that I just made yesterday about antibody testing to try and make it a little bit interesting and fun. We'll see if I succeeded in that or not. Just to talk about antibody testing. I can tell you, actually, I got the antibody testing last week. Our pathologist said, "Hey, why don't you get it?" And so I decided to get it, and I'm negative. So it was interesting, at least, because I've actually been involved in the care of COVID positive patients, and I've been in rooms with these people, and of course wearing all the appropriate personal protective equipment, and it worked because I have not gotten COVID. So, and I know I've felt fine this entire time. So. It really hasn't occurred to me to get the nasal swab because I don't really feel sick, even though there is some pre-symptomatic, asymptomatic spread. Well, here's a good one. This is great. Do you recommend those who marched in the Black Lives Matter protest here a week ago be tested? I mean, I'll just comment. I'll see if you have any thoughts, Sue. For the video that I saw of it, it looked like everyone did a great job and were masked. And so I think if that's true, from what I saw, if that's true, I don't know that without symptoms you need to worry about getting tested. I don't know that it'll help you at all. But I think that the protest and the march across the bridge was handled really, really well. It was well managed, and as I say, I saw a lot of masks, if not almost exclusively. So Sue, I don't know if you have any thoughts from a public health perspective?
Yeah, I would agree, and we still recommend testing for just symptomatic folks, unless of course you're an employee in a situation under study from public health or a healthcare provider that's doing routine testing, as some of the nursing homes have done.
Yeah. You know, I was thinking about this because there's been varying takes, I guess, and it's confusing for me, and I sort of follow this in a nerdy way, the whole idea of whether or not we should be tested or whether we should ask to be tested if we're asymptomatic or pre-symptomatic seems to be the new word that I'm hearing more. It's interesting because on the one hand, there supposedly is about a 40 to 45% part of the population that may be asymptomatic or pre-symptomatic, whatever the story comes out of the World Health Organization, that's changed a couple of times. But as a physician, there's a lot of things that, we generally speaking don't go on fishing expeditions for someone. Like a great example is a thyroid blood test. If I feel fine, if I don't have any fatigue, if I don't have weight gain, if I don't have things that might suggest I have a thyroid problem, it would make no sense to just get a random thyroid blood test because it doesn't really help you in the end. Because again, the thing with testing is you need to have a question you want to answer, and then how will that test result answer the question, and what can you do with those results once you get that result? And so I tend to look at it in that way. I hope that's not just babbling on, but I've been thinking about this a lot as far as why don't we do asymptomatic testing, and what's the deal? Why are we not doing that? I think that's probably the reason. The other thing is too, is if you aren't feeling sick today and you get the test and it's negative, let's say a week from Tuesday, you start having fever and cough and that sort of thing. You still got to get tested then too, because then you might not have had it then, and now you do a week from Tuesday. So, it's also similar to, and now I am babbling on,
Okay.
It's also similar to what I tell people when I do a stress test. When I have people do a stress test, is they have chest pain, we'll do a stress test and it's negative. That means that right now their chest pain is not apparently as a result of their heart. It doesn't mean that you couldn't have a heart attack 3 days from now, or 4 days from now, or a month from now. So it's just kind of interesting discussion about how testing works and how we tend to think it through.
I was thinking just what you described, that one test is simply a snapshot and things can change by tomorrow.
Yeah.
So.
Kelly asks, are there any new treatments, things that seem to be working that prevents infected individuals from ending up in the ICU as severe cases? I'm not aware of there being any specific new treatments that have worked to any great degree. We've all heard on the press about hydroxychloroquine. I think that's sort of successfully been, I don't want to say debunked, but I think it hasn't shown to be very effective. And really there hasn't been much else. There are things that, it's kind of, I guess the story is the same as it was when this whole thing first started. There's a number of different things. Some of them are benign, like vitamin C, IV vitamin C, if someone ends up in the hospital before they get super sick. Some of those things may or may not help. The problem is we're at that time of the disease process where you don't have the time to do a randomized controlled trial. So first of all, randomized controlled trials that everyone throws out, those have always been meant for drug trials. Those aren't meant for, you would never have a randomized controlled trial for whether or not a parachute is advisable for jumping out of an airplane. You don't need that, do you? Because it tends to make sense that if I jump out of an airplane and I have a parachute, I don't need a randomized controlled trial for that. So that's kind of why we do a lot of things by, does this make sense? This is what some early data shows. But that's, again, a long-winded answer to the question, is there anything new? I don't believe so. Is COVID transferable by mosquitoes or flies? Not to my knowledge.
Not to my knowledge.
It's
either.
still, this continues to be, it has sort of been from the beginning, and I think it's been shown more and more for sure. This is a respiratory droplet disease, which is kind of why we wear the masks. And someone said, it seems to me just wear a mask, wash your hands, and physical distance whenever possible. That's true. That's kind of the best thing we can do right now for this. I know not everyone's crazy about masking, and there's all kinds of, it's funny how everything in life seems to fall down along somewhat political or ideologic lines, but I think wearing a mask is probably the easiest, most benign thing that we can do to prevent the spread of it. Because we do seem to know with fairly good certainty that this is spread as I talk to you. If I'm talking to you within 6 feet, and the louder I talk, if I sing at you what you wouldn't want, if I sing at you, whatever, the chances of you getting it from my respiratory secretions are good if I have the virus, and that's the problem. We just don't know. So I don't expect that masking will be forever. So I think that's what a lot of people are tending to bristle against, is you're telling me now I have to wear a mask. I think this will, time will tell. This is not going to be forever. So for right now, I think the longer we can prove that we can keep this thing at bay, I think the better off we're going to be, wouldn't you say?
Mm-hmm. And that's going back to, we were talking before we went live about those three things: the masking, social distance, and washing your hands are really the key for everyone to do.
Yeah. Once there's a vaccine for COVID-19, will you make your employees get it? It's a good question, and there's a couple parts to that. One would be that the vaccine has to be shown to be safe and effective. Like we have vaccines for so many things, for influenza, for measles, mumps, rubella, those sorts of things. Those are all effective and they're safe. So we have to get to that point first. Second thing is we generally require, as an employer, we generally require employees get vaccines that are scientifically, acceptable and within evidence base. But we don't. If someone has religious or other reasons that they don't want to take vaccines, we don't require that. So I think the bigger point for the general public is we would need to have the vaccine be safe and effective before we would ever say you have to all get it. So I don't imagine we would be one of the early adopters where we'd say, oh, there's a vaccine now, we're not really sure how it goes, but we're going to make everybody take it. That would not be us. This is a good one too. My friend went to the ER and the doctor and nurses used hand sanitizer, but none of them used gloves, which I thought was weird. That's a really good comment, and I appreciate you bringing that up, Tammy. The reason that is we wash our hands a lot. I'm in the garb right now. I'm currently hospitalist in our hospital just upstairs, and that's what I'm doing. I don't walk around with gloves on. Reason is we wash our hands as we go into the room and as we leave the room. Sometimes I'm guilty of, in the emergency room, I leave the room and there's a sink right outside the room, so you may not see me wash my hands. We wash before, we wash after. Wearing a glove wouldn't necessarily help. It wouldn't hurt, I suppose, but you have to sort of take off the glove in between every interaction. So, good question. But generally speaking, we wash our hands frequently, especially now. Healthcare, generally speaking, always needs improvement as far as hand washing is concerned. You would think that would be a no-brainer, but we still have work to do everywhere, not just here, everywhere as far as hand washing is concerned. Maybe you can take this one. With the large number of people who gathered for the peaceful protest in Sturgeon Bay, how does that differ from fans gathering to watch the races in Sturgeon Bay?
That's a good question. So I'm hoping, I didn't see the demonstration and I didn't catch much of the news, but I'm hoping they were able to social distance like you described. The races in Sturgeon Bay draw a crowd, I'm told, of about 200 to 500. Although I've never attended the races, but that's what I was told. So I've had a lot of questions about large gatherings. And in general, the more people that gather and the longer the interaction lasts, the more potential risk of becoming infected with COVID. So I don't know how long people were at the demonstration. A race would last maybe longer than that, and then would be higher risk. Other factors about large gatherings are the higher the level of community transmission in the area that the gathering is being held, the more the risk. Well, right now we're in good shape, so that means low risk. Can we gather in larger groups? Well, perhaps. More risk is smaller outdoor in-person gatherings from with individuals from different households from the same local area. And then higher risk is if people are from outside the area. So I think that puts us at higher risk. What we're doing at the county is watching the state numbers and the information that comes through of trends to make determinations about whether our guidelines will be relaxed for group sizes. And the next step would be that up to group sizes of 50. So the last thing that's going to be deemed low risk will be the huge gatherings of over 50. So any of the festivals, events, parades, that type of thing.
Yeah, and I think these are, I think it's important to point out that these are not easy conversations to have in a general sense, and certainly not, behind closed doors, in air quotes, at Sue's office, at my office, things that we do here. They're not easy questions. They're not easy things to tackle because, we're human and we'd love to see the races go on. Or that's one example, but there are other things too. The triathlon, things like that. We'd love to see those things go on. And I am very susceptible to saying, well, maybe if we just, and the big thing is, and it's hard because I've never been, for anyone who knows me, I am not a nanny state type of a person. I'm just not. I think we're all adults. I think we have personal responsibilities. So I think this is new territory. I think we all have to remind ourselves we have not had a pandemic like this in our lifetimes. Any of our lifetimes. I mean, for the most part, there's always a few outliers, but generally speaking, that's kind of where we are. So these aren't easy questions, and I know it's easy. I know you catch a lot of slack, and that's fine. That's one of the things we signed up for. But at the same time, they're tough.
So I guess weighing the situation as to how much risk to the public for these recommendations. So there's risk every time you step out your door.
Absolutely.
Whether you're driving in your car or whatever. So there's never going to be no risk, but to give recommendations for what sort of risk in which situations, and if it's determined high risk or low risk, to help people make decisions.
Yeah. Karen has a question. When wearing a mask, if it becomes damp on the inside, can that make the virus come through easier? And if yes, then should it be changed? That's a good question because I think the idea is, the way that I look at wearing masks, again, is it's the average person on the street wearing a cloth mask. It's just basically a barrier is what it is. So it's protecting you from spit. I personally look less, or I'm concerned less about the virus getting through the filtering ability of the mask. I'm less worried than that. In the hospital setting, we have masks that we know filter a vast majority of viruses. So your question about if it's wet, I guess it seems to me that if it's wet and if someone spits at you and that particular spit hits the wet part and could somehow soak through, I suppose that's possible if somehow it gets in your nose and it gets under the mucous membranes. So yeah, I think if it gets wet on the inside, I think I might change it or I might launder it. So any thoughts on that, Sue? And that's just a guess on my part.
I was just thinking I wouldn't want to keep a wet mask on.
Yeah. I always think my family and I are Disney nuts, and Disney World and Disneyland and all the Disney properties around the world are requiring masks. And I always think, can you imagine going to Orlando in the middle of summer with the heat and humidity that Orlando has and wearing a mask all day long? I mean, that just sounds like the opposite of fun, much as I love Disney. So we'll wait until Thanksgiving when it's a little cooler wearing masks. Maybe by then we won't have to wear masks. We'll see.
That would be nice.
Yeah. What will public schools look like in the fall? Not sure. That's a really good question, and that's one that I know that the school superintendents have asked Door County Medical Center, some of us, to be involved in a couple of meetings over the course of the summer. So I think we'll have to see. I know the CDC already has. Anyone can go on the CDC website, and they have recommendations, but they're tough. I mean, as far as I think one of the things it talks about is 6 feet in between desks, and if you have a classroom of 25 kids, what classroom is big enough for 25 kids 6 feet apart? So I think that might make it interesting and potentially difficult. So we'll have to see.
Public health is going to be involved with the schools also.
Sorry,
and,
yes.
Yeah, there's some guidelines slated to come out June 22nd from Wisconsin Department of Public Instruction, and I suspect that there's going to be more questions and answers because they'll give general guidelines, but lots of considerations like you mentioned. And one of the things I know that's going to be part of it is for the school to be able, if they have in-person school in the brick and mortar school, that they can also easily transition to at least part of the population at home in case there's a COVID case. That it wouldn't be a reaction, it would be, okay, we know how to do this, we have a plan in place. So lots of challenges.
Yeah, yeah. This is a really good question. Jan asks, what are the dangers of gathering in parks if wearing masks and social distancing? Do you want to take that?
I'll start and you can help.
Sure.
That in theory sounds lower risk. There's no guidelines that say outside is safer. If they exist, I haven't come across them, although all the literature encourages ventilation in rooms to be better. So, I suspect outside is less risk than inside, but there's nothing that really says that. And masking, social distancing, that is key. I think when you get large groups, larger than, any size, it's hard for people to really keep that social distance. So that's a consideration.
Yeah, I don't think I have much to add. I mean, I think for me personally, I haven't done much. I work all the time, so I haven't done much outside. But I think, the things that I have done, for me, what's most important personally is the physical distance from someone. Mask off. I want to make sure that I'm a good 6 or 10 feet away from them. People that I would hang out with or that I know, we're all kind of of the same mind, and so it's not that any of us are afraid. I mean, I that's one of the things. Maybe I'm delusional, but I've never been afraid personally of getting COVID throughout this entire thing. That's not been my fear at all. My bigger fear is for my family and for people that I know, that if I've somehow gotten it and don't know about it, because I've known people that have gotten it and didn't have a clue that they had it. So that's my fear, is that I'll get it, give it to someone inadvertently, and they might get quite sick from it, whereas I might not have. So that's my big concern. I don't know the answer to this. Nikki asks, can kids play on playground equipment yet? I see kids at all the parks playing lately, and my kids are getting antsy.
I do not know the answer to that, except the guidance for amusement parks is that all the equipment should be cleaned between riders and that type of thing. So
yeah, I think a lot. I mean, my personal feeling on a lot of this too is if you, and I know with young children, well, and even I have a teenager, so even teenagers, it's a problem. But with kids, if you can get them to wash their hands and avoid touching their face, probably not in that order, but if they're out playing, don't touch your face and don't, that sort of thing. And then once you get inside and they're finished playing, if you wash your hands for a good 20 seconds, I think generally speaking, you're okay. But that's just my take. As Sue said about something else, there may not be documentation that says that's so, but that to me makes the most sense. So rather than, I think I would spend less time scouring down a piece of jungle gym with bleach than I would just having the kids wash their hands and don't touch their face, which I understand is a tall order sometimes.
I would be more concerned too how many children are there from, if I was taking my children to a playground, is it just those kids or are there other kids and how many and all of that?
Yeah, here Amy says parks, playgrounds in Brown County are open, but they've posted signs that say to play at your own risk because they're not able to keep them clean and sanitized. Yeah,
Right.
I think that's something else that I find, I guess not unexpected, but interesting, is that a lot of places are starting to put signs up that basically say, come here at your own risk. Disney World, which I mentioned, they have signs that say, you could get sick being here. So they're trying to, which I think would be obvious, but I think in today's litigious society, I think it probably makes sense to put signs up saying, hey, you're here at your own risk. Just be smart about it. That's it for questions. So we're at 6:25 right now. Is there anything else we should talk about? Anything else you want to talk about?
I think I covered it.
You covered it? Okay.
I'll think of it as soon as we.
Yeah,
get off.
I know. That's why I'm trying to, without looking silly, I'm trying to go through my brain and think about what. So you said we had 400 tests.
Mhm.
Yeah, and only 3 were positive, but none of them were from door.
Right.
That's pretty darn good. So
That's a
yeah, and
good
I know
rate. Right.
our, I can tell you, we have a dashboard that we look at every single day that keeps us up to date. And as of today, we have 2.67, so 2.7% positive. So out of the 1,500 that we've performed, only 40 have been positive. So that's pretty darn good. And antibody tests, we have performed 143 antibody tests, and only 1 has been positive. So that's interesting. So I guess from the antibody perspective, I would say if you have interest in getting the antibody test, you can certainly contact your clinician, and they can talk to you about that and get that set up for you. Again, I just want to remind people that the antibody testing is good to tell you whether or not you've had the infection or not. That's all it tells you. We don't know enough yet to know whether or not it would tell you if you are immune. So if you came back positive, would that mean you're immune? Don't really know. And even if you were immune, is it lifelong? Is it fleeting? Don't really know. So that's why it's like anything else. We need to be careful with using it. But certainly it's another opportunity, if you're concerned or interested, that you have that at your disposal. Most insurances cover that testing, so I don't think we've had a single one on the area that doesn't cover it for the most part. We always tell people, if you're not certain, you can check with your insurance carrier and they'll tell you for certain. But I know Prevea 360, which is pretty much the predominant one in town, there's no out-of-pocket cost to the individual. I never say it's free, because nothing is free. I mean, someone's paying for it, but with the insurance coverage, there's no out-of-pocket cost. Let's see. Yeah, this is a really good question. What will deem wearing masks being over? I don't know the answer. I really don't. I think a lot of it is that, there's definitions out there, and in fact, even amongst my colleagues as physicians, there's a lot of questions about, well, how do we know this is over? How do we know this is good or okay? And that's a hard question. The definition of what is a surge, and I was just the surge is once cases have stopped accelerating, all of a sudden they reaccelerate. That's a surge. So I believe by that definition, we have not had a second surge yet. This is still kind of the ongoing. We flatten the curve, but all that means is the curve is now this very shallow, flat hill that takes forever to get over, as opposed to getting over the mountain and being done. So I don't know the answer as far as when will it be over. If some science comes out that basically says, hey, the masks literally don't help spread the disease, so they don't help you prevent spreading. Once that science comes out, I think then that might be a time.
I don't think it's time yet.
No, I would agree. By no means is the time
for
yet.
Today,
I think
please wear a mask in public.
Yeah, the best we understand right now, it still makes sense. And I would say too, again, just personal experience. I mean, I've been involved with COVID positive patients. I've worn a mask. Now I know they haven't been cloth masks, but to me, it just makes logical sense. And I'm not saying that because I have an agenda. That to me makes sense, and that's what I'm going to do for my family. Were all businesses at the industrial park and Bay Ship encouraged to have their employees tested when the National Guard were here? I don't know the answer to that. I mean, as far as what the employers did, everyone was able to come. I actually was a little surprised, frankly, that when they came for 3 days, that we had only 400. I was hoping it would be a lot more than that. So I think that just demonstrated that a lot of people either don't care if they have it, or like in my case, I didn't think I had it because I feel fine, so I didn't want to get tested. So
We had more capacity, but I think that what our numbers were about average from other
that right?
community sites. Yeah.
Okay, good. All right. Well, I think we're going to wrap it up. I once again really appreciate your allowing us to come into your lives for this short time and answer questions. Questions were, as always, very good, and we really appreciate that. Sue, thank you so much for being a part of this. And we're going to continue to do it every other week, and we'll see if this is useful. We want to continue it, and we'll be here if anything comes up. So, as I say every time, stay safe and be well.